Hello, this is Dr. Gay from First Look MRI, and this is a case of fibromatosis. So there is something we see commonly called a plantar fibroma, and that's in the plantar fascia back here. And the plantar fascia should be nice and dark and smooth, and if we see a localized, well-defined area of intermediate signal, we call that a plantar fibroma. And this patient has a beautiful plantar fascia, but more distally, involving the plantar soft tissues and some of the fascia, they had this more irregular, ill-defined, infiltrative process, and this is plantar fibromatosis. Again, it's more infiltrative, it's not in the classic location. You can see here on the T1 image, it's ill-defined and some mass effects. Sometimes it can even erode bone. On the short axis T1 image, we can see the process probably even better. Here we go, beneath the second and third metatarsal heads. Also down here beneath the first metatarsal head. But you can see the process dissecting into the fascia, even goes deep and surrounds the flexor tendon of the second toe here on this image. Now this patient also had some intermediate signal here between the second and third metatarsal heads, and this is a Morton's neuroma or perineural inflammation. They had a history of prior Morton's neuroma resection, but there's residual gray signal here. You can see this best in the short axis T1 image here, and also in the long axis T1 image between the second and third metatarsal heads. So this gray signal, normally you see a little bit of separation and some fat, but on this view right there, you can see it best. Now the third and fourth metatarsal heads, you see that nice fat, a little bit of separation. And again, back to here to the area where we see intermediate signal with a little bit of mass effect there. On the fat suppressed images, this doesn't seem to show up as well. Sometimes it's intermediate and sometimes it's mildly hyperintense like this, but it's best seen on the T1 weighted images, where there's a sharp delineation between the fat that's really bright and then the Morton's neuroma that's really intermediate to dark. And this patient had one more little thing here. This is between the first and second metatarsal heads, had a little intermetatarsal bursal effusion. So thank you very much.